I am Wendy Beckles, President and CEO of Shepherd Village. On behalf of the board, staff, and residents of Shepherd Village, it is my privilege to welcome you here today, whether joining in person or virtually. I would like to take a moment now to acknowledge the land we deliver services on. This is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13, which was settled in 2010 with the Mississaugas of the Credit. A special welcome to our Members of Parliament, the Honourable Jean-Yves Duclos, Canada's Minister of Health, the Honourable Kamal Khera, Canada's Minister for Seniors, Ontario's Minister for Seniors and Accessibility, Raymond Chow, we welcome. And Jean Yip, MP for Scarborough Agincourt, our best friend in Ottawa, who actively supports and advocates for the Shepherd Village community. Welcome. Shepherd Village is a seniors campus that provides a continuum of care and is home to approximately 900 seniors, 250 of whom reside in our long-term care home, Shepherd Lodge. Supported by a staffing complement of over 400 frontline healthcare professionals, our passion is to serve our seniors with dignity and respect. Today, on behalf of Shepherd Village and long-term care homes broadly across Ontario, I applaud the Government of Canada for acknowledging the need for more supports and services that will strengthen our capacity to serve long-term care residents through a robust federal and provincial partnership. What we know is that models of care need to rapidly evolve and need to be adequately resourced in order to meet the increased demand within our seniors' communities in ways that prioritize their health and safety, particularly when they are advanced in age and most vulnerable. The pandemic has provided a unique perspective on the fissures within the system. More importantly, the opportunity for governments and sector partners to think about what these care models can look like and the investment that will be required in anticipation of the system demand that is looming. For example, Ontario's population over 80 years old is expected to double in just 13 years, and there are not nearly enough planned spaces today to meet that demand, and that is only Ontario. The need for unprecedented and accelerated investment could not be more urgent. Whether investing in infrastructure or people, it will take bold thinking, collaboration, and innovation as we work together to support aging populations from coast to coast. Although the goal is to have citizens live in their home as long as possible, it eventually becomes unsafe or impossible, even with extensive family and home care supports. Substantial investment is needed to make sure that long-term care is available on demand when our seniors need it. That is why we are encouraged that governments at all levels are prioritizing safe, accessible, long-term care. Today's announcement is an important step in the right direction and presents an opportunity for the federal government to demonstrate national leadership on a major social issue. With that, it is my pleasure at this time to invite to the podium a friend of Shepherd Village who supported us tirelessly by providing critical PPE and up-to-date information throughout the pandemic, often just checking in to make sure that we were okay. Jean Yip, MP for Scarborough, Agincourt.
Thank you, Wendy. Good morning, everyone, on this rainy day. It's much appreciated that all of you came. It is a real pleasure to be joining you along with my Scarborough colleagues, MP John McKay and Salma Zahid at the Shepherd Lodge Long-Term Care Facility. I would like to warmly welcome the Honorable Jean-Yves Duclos, Minister of Health, the Honorable Kamal Kura, Minister of Seniors, and the Honorable Raymond Cho, Provincial Minister of Seniors and Accessibility, and MPP Aris Babikian. I also want to thank Wendy Beckles as the CEO and President of Shepherd Village, the largest non-profit seniors community in Toronto, serving over 900 residents over 60 years. Shepherd Lodge is among many long-term care facilities that faced hardship over the last 2 years. And Wendy has worked incredibly hard throughout the pandemic to keep seniors safe. Thank you, Wendy. In Scarborough Agincourt, we have a large seniors population, so this announcement hits close to home. Further, as the co-chair of the Liberal Seniors Caucus, I am proud that our government values the need to keep seniors safe and improve their quality of life. I would now like to give the floor to my friend and colleague, the Minister of Health and Member of Parliament for Quebec, the Honorable Jean-Yves Duclos. Bienvenue.
Bonjour tout le monde. Good morning, everyone. First, thank you, Wendy, for your warm welcome on this particularly cold day. You may know and you may hear that I come from Quebec City, where we are very accustomed to cold days. That's why I insisted I would be able to come today to visit Scarborough, to be in a much warmer environment. I suspect I'll get another invitation, Wendy, to visit you at a later time when the weather is even, or perhaps better than today. But your warm welcome, your kind words are very felt and appreciated. Now, we feel through you, your leadership and the leadership of your team in looking after the seniors of this residence. Obviously, I'd also want to thank Minister Cho, Raymond, for being a leader and a partner in this community and with the federal government over the last difficult months. Also, obviously, celebrate the presence and the leadership of Jean. Jean, to have a wonderful ally and friend in this community would be great, would be wonderful and much appreciated. We also have a wonderful ally and friend of this community in Ottawa, as John and Salma also are and also know. Obviously, I want to say how proud I am and how fortunate I am to work with Minister Kamal. You will know, and if you don't know, you now do know, that Kamal is a former nurse, but not only a former nurse, she's still a nurse in heart, and in fact often in body, because she continues in discreet manners to look after the vulnerable people of whom you spoke earlier, Wendy. We are fortunate in the government to have someone of the credibility, experience and commitment that Kamal displays every day in her work. Now, John and Salma, thank you for welcoming us to not Ontario, not Toronto, but to Scarborough, I understand, which is a great center of the universe. That's good. That's I used to. I sometimes believe that Quebec City is the center of the universe, but that must not be true anymore. So I'm obviously therefore joined by many distinguished and wonderful colleagues for an important announcement that will help improve the lives of many people in this community and elsewhere. And over the last 2 years, we have indeed seen many gaps in infection control, in staffing, shortages, how to support our healthcare workers, who support our residents and seniors in many communities, including in this one, infrastructure gaps as well, with often, unfortunately, tragic impacts on residents on their families and those working in long-term care homes like this one. Now, we know that these challenges existed before COVID-19, but they have been aggravated by the crisis. And as a government, therefore, we must continue to work with all partners, including the Government of Ontario, so that all seniors get the care that they need and they deserve. Nous sommes donc déterminés à travailler avec tous nos partenaires des provinces et des territoires, tout en respectant évidemment la compétence de ces provinces et de ces territoires en matière de gestion et de livraison des soins de santé, pour relever ces défis qui ont été aggravés et rendus encore plus évidents durant la COVID-19 pour ceux et celles qui non seulement vivent, mais qui travaillent dans les centres de soins de longue durée, comme ici à Scarborough. And that is why our government created the Safe Long-Term Care Fund, a $1 billion fund which is being used to help provinces and territories protect those living and working in long-term care settings. It's about protecting those that live, the residents, but also protecting the health and safety of those that work in the long-term care centers. And in both cases, their physical and mental health has been severely impacted by COVID-19. In budget 2021, we also invested an additional $3 billion over 5 years, that's about therefore $600 million per year, to starting this fiscal year, to support provinces and territories in their continuing efforts to ensure that standards for long-term care can be applied and permanent improvements can be made over time. Now, this total funding will be available to help provinces and territories do all sorts of things, which we know we will be able to not only identify but also implement, obviously, including strengthen compliance and enforcement activities and support workforce, so the healthcare workers, including through wage top-ups and improvements to workplace conditions, including, for instance, hours of work, stability in their workplace, staff-to-patient ratios, all elements of workforce support that matter not only for workers, but obviously for the residents for whom the workers care for. Which brings us to today's announcement. The Government of Canada has recently signed an agreement with the Government of Ontario that will improve the health and safety of long-term care homes in this province. Le gouvernement fédéral versera à l'Ontario plus de 379 millions de dollars pour la prévention et le contrôle des coûts et des reliés à la protection contre l'infection, des coûts associés à l'amélioration des conditions des travailleurs de la santé, ainsi que l'amélioration des infrastructures dans les établissements de soins de longue durée ici en Ontario. And therefore, with this $379 million support from the Canadian government, the province of Ontario is developing an action plan that is setting out exactly how that will be used, which includes they are hiring additional staff and introducing wage top-ups and training, ensuring an adequate supply of personal protective equipment for residents, staff and visitors, and strengthening infection prevention and control measures. Cette annonce est donc une excellente nouvelle pour les aînés de cette communauté et pour tous ceux et celles qui habitent dans les centres de soins de longue durée partout en Ontario. Conditions of care and quality of care are directly related to the work conditions of the frontline workers that support our most vulnerable, as Wendy said earlier, and that's why we all need to continue to work together to step up for those workers. En conclusion, je termine en disant que nous travaillons ensemble depuis déjà presque plus que 2 ans, depuis le début de la crise de la COVID-19, mais on était déjà en collaboration et en appui parce que, comme on disait, avant même la crise de la COVID-19, il y avait des enjeux sérieux de court et de long terme en matière de protection de la santé, de la dignité et de la sécurité de nos aînés. Last month, we therefore announced an additional investment of $2 billion to help our provincial and territorial partners to significantly reduce the backlog of surgeries that have been delayed because of COVID-19. This investment is part of a broader list of priority areas, I would say common priorities area in healthcare, which are A, reducing those backlogs in surgeries and diagnostics, support our healthcare workers, B, enhancing access to health through family health services, C, improving mental health and substance use services. D, help Canadians age in dignity and respect, as Wendy said earlier, and sometimes close or closer to home. And finally, using healthcare data and digital health more effectively to increase the efficiency and the equity of our healthcare system. By focusing on those areas, we will help ensure that our healthcare system is better suited to the long-term challenges that we need to address to keeping everyone healthy and safe in this community and all other places in Canada. Thank you. Merci beaucoup. Miigwech. I'm sorry, I should do my role well. If I want to be invited once more, Minister Cho, would you want to come?
Good morning, everyone. Bonjour. I'd like to thank the Minister Duclos for introducing to the podium, and merci beaucoup. Now, I'm with my favorite MPP, hardest working MPP Alice Babikyun of this riding Scarborough Agent Corps. Now, I'd like to welcome everyone to Scarborough. I'm pleased to be here on behalf of my colleague, Honorable Paul Calandra, who is in Ottawa today, to make an important announcement regarding the long-term care in the city. We welcome this one-time contribution, approximately $379 million by the federal government. Merci beaucoup. As you know, Ontario has a plan to fix long-term care that has three pillars. One, improving staffing and care. Two, strengthening accountability, enforcement, and transparency. And three, building modern, safe, comfortable homes for our seniors. Under each of these pillars, we are taking action. We are investing almost $5 billion over 4 years to improve staffing and reach our goal of providing an average of 4 hours direct care for residents per day. We are doubling the number of inspectors in the province and launching a new proactive inspectors program. We are investing $6.4 billion to build more than 30,000 new and 28,000 upgraded long-term care beds across the province. And we have passed the landmark Fixing Long-Term Care Act, which was proclaimed earlier this month. That's a total of $13 billion to ensure our seniors get the care they need and the quality of life they deserve. The progress that has already made and will continue to make is only possible because we have listened to each other and worked together. Of course, we still have more work to do, but when I see the incredible passion, the drive of the people working in long-term care sector, I know that we will get the job done. Thank you, merci, and I'm so pleased to invite my counterpart, the Federal Minister Senior Keller, to the podium. Thank you.
Minister Cho, once again for your kind words. I also would like to just thank everyone here for joining us today at the Shepherd Village in Scarborough Agincourt, represented of course by my very good friend and colleague, MP Jean Yip, who of course is no stranger to you and is certainly a strong advocate for her community, but indeed also for seniors as the chair of Seniors Caucus. It's always also good to see my good friend Salma Zahid from Scarborough Centre, and I know John had to leave, and of course welcome my outstanding cabinet colleague, Minister Duclos, who I know is a champion for healthcare in Canada. It's so good to see you here. But I did tell him that he's the one who brought the cold weather to Ontario. And of course, thank you, Minister Chow and our provincial counterparts for being here. We all know just how difficult the past 2 years have been for Canadians. And while the pandemic has affected all of us, we know that it has had a disproportionate impact on our vulnerable populations, especially seniors. From the tragedies in the long-term care homes to the profound impact of social isolation, particularly to mental health and well-being of seniors, we know just how challenging this pandemic has been for them. And it's no secret that the way we handle long-term care in Canada needs improvement. And the pandemic has further exposed some uncomfortable truths and the long existing gaps in how seniors are cared for in long-term care homes. We also need to ensure that those taking care of those seniors are not forgotten, who have been on the front lines of this pandemic for over 2 years now. They are tired and they are determined to continue fighting for the health and well-being of all Canadians. And as Minister Duclos had mentioned, as a registered nurse, I've had the opportunity to volunteer and return to the front lines at one of the hardest hit long-term care homes in Ontario, in my own community of Brampton, throughout the pandemic. And I can tell you, I've seen firsthand the critical gaps that their healthcare workers and residents face every day. One of the greatest tragedies of this pandemic, indeed, are the lives lost at long-term care homes throughout our country. And I bring those experiences with me every day in my role as a Minister of Seniors, and as such, one of the most important tasks is to do my part in helping improve the care for seniors from coast to coast to coast, and that's exactly what we are delivering on today. Today's announcement is about protecting seniors. It's protecting the most vulnerable of our society living in long-term care homes. This investment of over $379 million for Ontario under the Safe Long-Term Care Fund is the kind of news for the province that's needed that will help improve their infrastructure, build on initiatives to provide a safe environment for those living and working in long-term care. This announcement, of course, is part of the work that has already underway to strengthen the support of long-term care, which I know the Minister of Health and I have been doing with provinces and territories to improve infection prevention and control measures and to protect the residents in long-term care homes across Canada. It also builds on our commitment to make systemic changes to Canada's healthcare system and the long-term care system, and there is indeed a long way to go. We know, as the Minister Duclos had mentioned, in Budget 2021, we also announced $3 billion investments over 5 years to support provinces and territories to ensure that standards of long-term care are met and that permanent changes are made. And that work is already underway with the Health Standards Association and the Canadian Standards Association. Building on our commitment to support seniors, as you all know, we passed Budget 22, we introduced Budget 22 a few weeks ago, and it is going to ensure that we improve the quality of life for seniors through dental care for low-income seniors starting in 2023, by expanding the New Horizons for Seniors program, by establishing indeed an expert panel that the both Minister and I will be working on at Aging at Home benefit, by expanding the home accessibility tax credit, and indeed by creating a new multi-generational home tax credit for seniors so they can stay in their own communities as long as they need. Seniors have the right to comfort and dignity no matter where they live. And now that we've begun recovery from this pandemic, we have an opportunity to rebuild a better, stronger system to support aging adults. And as we move ahead, we will continue to work with provinces and territories to support them in protecting residents in long-term care facilities and make it easier for older adults to stay at home as they age in their own communities. We will ensure that those working in long-term care have the resources and tools they need to work in a safe environment and to provide adequate care for seniors. And by acting now, we can ensure that seniors are protected and have access to the health care they need both now and into the future. Thank you. Merci beaucoup. Language.
And I'll take questions from the media. Première ronde pour les questions des médias ici présents. So we'll start with questions from the media in attendance here before moving on to Zoom. Please state your name, the name of your outlet, and to whom your question is directed. Thanks. Any questions from media here today? Nope. Okay, so going over to Natalie for media on Zoom. Nathalie, est-ce qu'il y a des journalistes sur Zoom qui voudraient poser une question?
We should let's go on now. So we will, as mentioned, we'll now proceed to questions from journalists on Zoom. If you are a reporter and you wish to ask a question, please use the raise your hand function, and we ask that you limit yourself to one question and one follow-up. Unless it is stated already, please indicate your name and the media outlet as well as who your question is directed to. We will now begin, so we will start with Norton Walsh from the Globe and Mail.
Good morning, ministers. My question is for Minister Duclos on a different topic on the drug pricing changes announced late last week. Can you please explain why the government is dropping almost $6 billion worth of savings that you previously promised to consumers on patented drug prices?
Thank you for the question. There are two elements of first, last week's announcement was an important announcement for the objective of reducing drug prices in Canada. We know that drug prices are currently among the highest in the world, by some estimate either the second or the third highest prices in the world when it comes to paying for drugs. That obviously has an impact on the ability for people to access and to pay for those drugs. So that, yes, last week's announcement was key in driving a longer term fall in drug prices. At the same time, we are mindful that we need to have in Canada a strong pharmaceutical industry, especially given the lessons that we have seen through COVID-19. That's why we have worked strongly and closely both with the industry as well as with provinces and territories that obviously share both the cost of those drugs and the responsibility to increase our research and development and productive capacity for drugs and vaccines and many other tools that we need to care for people. So the good news is that we are able to set up a long-term path that is going both to reduce drugs and support research, development, and production capacity by pharmaceutical companies.
Okay, I'm a bit confused then. You know, you're saying Canada has the highest drug prices in the world, but you dropped the majority of the policies that would cut those prices. So is the government, when you say you need to you're balancing it out, or the compromises with having a strong pharmaceutical industry, does that mean that your government will not pursue more cuts to drug prices, that after 5 years this is what it's going to be? Or are you now pursuing other areas and ways to cut prices, and what are those?
That's a great question. Yes, indeed, we are focusing on that aspect of the regulation announcement that was made last week, which is to bring Canada more in line with a broader set of countries where drug prices are lower. So we want, with this regulation, we're going to move Canada closer to the level of drug prices that we see in comparable countries. The second piece of your question, which is also very important, is about other actions that we're taking to increase access to drugs, in particular on the part of lower income and more vulnerable Canadians, to keep investing in the strength of our research and development and productive pharmaceutical capacity, and bringing also important investments in terms of curing and caring for people with rare diseases. We have a strong investment and a strong strategy to develop drugs for rare diseases. We're going also to set up a Canada Drug Agency, which is going to, among other things, going to bring a national formulary, which is going to be more efficient, more consistent, and come with a lower cost for drugs across all Canada, always obviously in partnership with provinces and territories. And finally, we have a biomanufacturing strategy, which is going to invest about $2 billion over the next years, both, as we said, to secure access, reduce costs, and improve capacity and research and development around pharmaceuticals in Canada.
Thank you, Minister. Next question is from Lee Grifty. Lee, I've unmuted your line. You're welcome to ask your question.
Thank you, Minister. My first question would be, it's great to provide money for extra staffing, top up dollars for some staffers, but the big problem, I've been working long-term care all my life as opposed to being a journalist as well, and the big problem is finding staff and keeping staff. So you can throw millions of dollars at staffing problem in long-term care, which has been here for many, many years, but it's so hard to keep people and so hard to get people motivated to work in the field. What can we do about that?
I'll provide a first answer and then invite Minister Kara to provide her own insights, which, as we know, are key in understanding and supporting healthcare, the challenges of healthcare workers. So it's first of all looking after those healthcare workers that currently are supporting our seniors. These healthcare workers are tired. They have left in large numbers. They work around shifts and in ways that impact obviously their personal, family, and mental and health, mental and physical health, from a personal and professional perspective. So they have left in large numbers. They are fatigued and burdened, and many of them, unfortunately, if we don't provide further support to them, may leave in the next year or so. In Ontario, for instance, experts tell us that there may be up to one nurse out of 6 that may be leaving the profession just in the next year. A similar number is quoted in Quebec and in other provinces. So first, looking after our healthcare workers, our personal service workers, our nurses, so that they can choose to remain key in supporting seniors. Second comes the importance of bringing in new workers, but through greater investments in training, also greater recognition of credentials, often foreign credentials that available workers bring with them, making them better able to use their talents and their efforts at the service of our seniors. And finally, thinking of this as also anchored in communities and in infrastructure. So providing our workers and seniors with personal protective equipment that they have needed and they will keep needing to keep fighting against COVID-19, ventilation, the type of housing and services that they need to live in safety and in dignity. And therefore, I'll turn to Minister Kara for more perspective.
Thank you. I will just start off with first and foremost saying that I think we all know just how challenging this pandemic has been for seniors, particularly those living in long-term care homes, but indeed those working in these long-term care homes. And I can tell you, as someone who went back as a registered nurse to volunteer in my own community in Brampton, which was one of the hardest hit long-term care homes in Ontario at the height of this pandemic. I saw firsthand the real tragedies. I saw firsthand the real critical gaps that do exist, and we need to do better. And that's exactly, what we have been doing, of course, the announcement is about today. But I can say, and I think it's also important to acknowledge the fact that from the very beginning of this pandemic, our federal government has been there to support provinces and territories to do this important work. Whether it was around billions of dollars that we put forward to ensure we put forward and the personal protective equipment to ensure that those working in those long-term care homes and staffing can properly and adequately provide that care safely for, of course, residents in those homes. Of course, whether it was sending in and deploying human health resources, such as the Canadian Armed Forces or through the Red Cross to be able to do that important work on the ground. And of course, as Minister Duclos had mentioned around the investments we gave to provinces and territories with the Safe Restart Agreement to have that, build that capacity. But, you know, in the last two budgets, the money that we put forward, particularly around long-term care homes, of course, the $3 billion that we put forward to ensure that standards for long-term care are made and that permanent changes are made. That work, as Minister and everyone knows, is underway with CSA and HSO. And you know, that is important work, and these standards will ensure that those that live and work in those conditions, so we need to do a better job of making sure that we're creating those conditions to retain those nurses, to be able to have capacity to, of course, recruit more nurses. But I think today's announcement is a big one. It's part of the $1 billion that the Canadian government had put aside, you know, as a safe long-term care fund to provide support from prevention, you know, infection prevention control measures, to provide, of course, top-up wages, better wages for personal support workers or nurses, or to hire additional staff. And that's exactly the type of collaboration and work we're needed. And I can tell you, as a Minister of Seniors and as a proud registered nurse, this is a work that we're committed to as a government, and the Prime Minister has mandated us to do this important work, and that's exactly what we're doing.
Do you have a follow-up?
I do, yes, thank you. Whoever would like to answer. Now that we have a full government, whatever you want to call it, with the NDP, Mr. Singh has made it very clear that he wants to see private long-term care home ownership abolished in this country. I'm not sure he understands exactly how that came about, but has there been any discussions with Mr. Singh and the NDP party by the Liberals in order to explore removing private ownership from long-term care across Canada?
Thank you. Our relationship, our partnership with provinces and territories is based on a triple R: respect, responsibility, and results. And the first R is respect for jurisdiction. Now, we know that it's challenging for provinces and territories to hire the workers that they need, to train them, to look after them, to manage infrastructure, to provide the ventilation and other physical support that the workers and residents need in long-term care settings. That requires a degree of expertise and local management ability that is in the domain of provinces and territories, and they have our full confidence. So when we work with them, we work in a very respectful manner, knowing that there is a diversity of conditions across Canada, also a diversity of histories. Now, there are provinces and territories that have for a long time depended and used mostly public long-term care facilities, and others in other provinces have used mostly private long-term care facilities. So they have our full confidence in choosing the ways and means by which to use our federal support, determine in which places and in which manner that support is most useful to support our workers and residents.
Thank you, Minister. That is all the time we have for questions on Zoom, so I will turn it over to
That concludes our press conference for today. Thank you, everyone.
See you all. You have warm hands. That's